I want to start by saying something very clearly, because many people over 60 have never heard this from a doctor. Your sexual health does not expire with age. Desire does not disappear just because birthdays pass, and self-pleasure is not something shameful or unhealthy when done correctly. I'm Dr. Olivia Parker, a board-certified urologist, and today I want to talk honestly and safely about how to masturbate after 60 without harming your body, because what I see in my clinic might surprise you. Many of the problems older adults come to me with are not caused by disease. They are caused by simple mistakes that could have been avoided with the right information. Here's the part most people don't expect. Masturbation itself is not dangerous at any age. What becomes dangerous is doing it the same way you did decades ago without understanding how your body has changed. And those changes are real. If you stay with me until the end of this video, I'll explain exactly what changes matter, what mistakes to avoid, and how to protect your comfort, sensitivity, and long-term sexual health. Let's begin with something very important that almost no one talks about. After the age of 60, the skin, nerves, and blood vessels in the genital area become more delicate. This is not a disease. It is a normal part of aging. The skin becomes thinner, elasticity decreases, and natural moisture levels change. Blood flow can be slightly reduced, and nerve signals may take longer to respond. This means stimulation can still feel good, but the tissues are less tolerant of friction, pressure, and dryness. Many people assume that discomfort is just something they must accept as they get older. That assumption causes harm. Pain, burning, or soreness are not normal signs of aging. They are warning signals. Your body is asking you to slow down or change what you are doing. One of the most common mistakes I see is excessive friction. This happens when someone stimulates dry skin or relies on speed instead of comfort. In younger years, the body often compensated for this. After 60, it doesn't. Friction can cause tiny tears in the skin that you may not even see, but they can lead to irritation, inflammation, or lingering pain afterward. Medical research in dermatology and urology clearly shows that aging skin is more prone to micro-injury, especially in sensitive areas. That is why lubrication becomes essential, not optional. Using lubrication is not a sign of weakness or dysfunction. It is a sign of intelligence and self-care. A good lubricant creates a protective barrier that reduces friction and allows stimulation to remain comfortable and safe. Water-based lubricants are usually gentle and easy to clean. Silicone-based lubricants last longer and are often better for extended sessions. What matters most is avoiding products with strong fragrances, warming agents, or harsh additives, because mature skin reacts more strongly to irritants. Another point many people overlook is speed. Faster is not better. As nerve response changes with age, slower and more intentional movement actually improves sensation while protecting the tissues. Rushing stimulation often leads to overstimulation, numbness, or discomfort afterward. Now, let me say something very important. If stimulation ever causes burning, sharp pain, or soreness that lasts beyond the moment, that is not something to ignore. That is your nervous system signaling that something is wrong. Ignoring these signals repeatedly can lead to chronic sensitivity issues that take much longer to heal. There is also an emotional side to this conversation. Many older adults carry unnecessary guilt or embarrassment around self-pleasure. That stress alone can increase muscle tension and reduce natural comfort. When the body is tense, blood flow is reduced and discomfort becomes more likely. Relaxation is not just psychological, it is physical protection. Studies published in journals like the Journal of Sexual Medicine show that healthy sexual expression, including masturbation, is associated with reduced stress, better sleep, and improved quality of life in older adults. The key word here is healthy. That means listening to your body instead of fighting it. Before we move on, I want you to remember this. Your body is not broken, it is different, and when you adjust your approach, you protect your comfort and your confidence. In the next part, I'm going to talk about two mistakes that are even more damaging than friction. One involves pressure, and the other involves ignoring pain. These are the mistakes that cause numbness, lingering discomfort, and fear around sexual activity later in life. Stay with me, because understanding these could save you from months or even years of avoidable problems. Now, let's continue, because this is where many people unknowingly harm themselves. The second major mistake is using too much pressure. This happens when someone grips too tightly or presses too firmly in an attempt to increase sensation. What actually happens is the opposite. Excessive pressure compresses blood vessels and irritates nerves. Instead of improving sensation, it reduces it. In urology, we see this pattern often. Patients report numbness, tingling, or a temporary loss of sensation after stimulation. They assume something is seriously wrong. In many cases, it is simply nerve compression caused by excessive force. Aging nerves take longer to recover, which means repeated pressure can create longer-lasting problems. Gentle contact is far more effective and far safer. Think in terms of comfort rather than intensity. Stimulation should feel pleasant, not forced. If you ever notice numbness, loss of sensation, or tingling, that is a signal to stop and allow the tissues to recover. Continuing through numbness increases the risk of injury. The third and most dangerous mistake is ignoring pain. Pain is not part of healthy sexual stimulation. It is not something to push through. Pain is the body's alarm system. When you ignore it repeatedly, you train your nervous system to associate stimulation with discomfort, which can lead to anxiety and avoidance later. Pain can come in many forms. Sharp pain, burning, stinging, aching, or soreness that lasts after stimulation are all signs that something needs to change. This could be as simple as adding lubrication, reducing pressure, slowing down, or changing position. In some cases, it may indicate an underlying condition such as skin sensitivity, inflammation, or a urinary issue that needs medical attention. One of the healthiest habits you can develop is pausing. Stop when something feels off. Reassess. There is no rush. Sexual health is not a race. Slowing down improves awareness and reduces injury risk. There is also a posture component that many people overlook. Holding tension in the abdomen, thighs, or pelvic floor can restrict blood flow and increase discomfort. Relaxed breathing and comfortable positioning help the body respond more naturally. When the body is relaxed, stimulation feels better and recovery is faster. I want to share something reassuring. When done safely, self-pleasure can actually support sexual health as you age. Gentle stimulation promotes blood flow, supports nerve signaling, and helps maintain awareness of your body. Some research suggests it may even support pelvic floor health and emotional well-being. The key is respect for your body's signals. Start slowly, use lubrication generously, apply gentle pressure, pay attention to sensation, stop if pain appears. These are simple rules, but they make a profound difference. If you ever feel persistent pain, ongoing irritation, or sudden changes in sensation, please speak to a healthcare professional. These issues are common, treatable, and nothing to be embarrassed about. As a urologist, I can tell you that early conversations prevent bigger problems later. Let me leave you with this final thought. Aging does not mean giving up pleasure. It means approaching it with wisdom. When you care for your body instead of pushing it, you protect not only your comfort, but your confidence and quality of life. If this video helped you understand your body better, take a moment to like it and share it with someone who might need this information. And if you want more clear, respectful, research-based conversations about sexual health after 60, subscribe and stay with me. Your health matters at every age, and you deserve accurate information without shame.